Welcome to Retina Health for Life. I'm Dr. Timothy Murray, coming to you from Miami, Florida, as the Foundation President for the American Society of Retina Specialists. It's my pleasure to introduce a colleague and a friend, Dr. R.V. Paul Chan, who is both the professor and chairman of the Illinois Eye and Ear Infirmary at the University of Illinois at Chicago. Dr. Chan is an expert in pediatric retinal diseases and retinopathy of prematurity. Paul, thank you for joining us to discuss retinopathy of prematurity today.
Thanks, Dr. Murray. It's a pleasure to be here to discuss this with you.
So, Paul, you spend a lot of your time in the pediatric retina world. You work with colleagues that are experts in pediatric retina, but you also spend a lot of your time taking care of these extremely premature infants and these young babies that develop or are at risk for retinopathy of prematurity. Can you tell us what retinopathy of prematurity is?
It's a condition that affects the retina, which is the back of the eye. The children at risk are children who are premature. Specifically, at least in the United States, the children that we screen are less than or equal to 1,500 grams or less than or equal to 30 weeks gestational age at birth. So basically, what happens is that the retinal vessels, they need time to catch up. And what I usually tell families, it's like everything else, in this premature child, that when you're born early and young and you're born low birth weight, that not everything is developed as it would be as if you were born full term, right? So the retina is the same way. And what happens is that the retinal vessels, instead of being completely developed as they would in an older child when they're born, they can sometimes stop, right? And what happens then is that you can get new vessels that grow, and ultimately these vessels can potentially even cause problems like bleeding, and more importantly, cause something called the retinal detachment, where the retina can separate and potentially cause permanent blindness.
So the risk factors seem to be born very, very early and having a very, very low birth weight. But these babies can't tell us how they're doing. So how do we screen for ROP in these infants?
Right, exactly. And this is so critically important. So when they're born light and they're born young, obviously they're going to be in the NICU initially, and it's going to be very important that your children have these initial eye exams. And generally speaking, they occur at about 4 weeks after birth or at 31 weeks gestational age, depending on how young your child was born. And how do we do the exams? Well, we do the exams at the bedside, generally speaking, using a special headset and a lens to look in the back of the eye. Dilating drops are placed in the eye to help us see and do the exam. Now, that's the traditional model. Nowadays, many times, physicians, retina specialists, pediatric ophthalmologists, they will use telemedicine, right? And so they'll use digital cameras to take an image of your child's eye and then document this. And either they can read it that day in the NICU or read it that day, generally speaking, through a remote method. But you can either do the exams either with indirect ophthalmoscope, with the special lens, or with special cameras, and it gives you very good information about what is happening to the retina.
So when we need to treat these babies because they're so little, how do we treat them? What's available to treat them, and how do these babies do?
Right, and this is incredibly important because nowadays we have many or different treatment options, and I think maybe about 10, 15 years ago we were just using laser treatment to treat these children. Now we have injections of medicines, and the general category of these medicines is something called anti-vascular endothelial growth factor medications, so anti-VEGF. Right now, you have these injections of medicines in addition to the traditional laser therapy. Now, having said that, it's going to be very important that if your child does need treatment, that you have this discussion with the physician and with the retina specialist or pediatric ophthalmologist about what is the right method for treatment for your child.
Well, one of the things, Paul, you focused on is that with early screening and early treatment, that we've virtually eliminated blinding retinal detachments in these very, very small infants. That seems amazing.
Yeah, and I think that's a critical point, that Nowadays, with early screening, with exams, it's very unlikely for your child to develop a retinal detachment if they're screened early and if you're making your exam. So some fundamental points is that, we're not going to be able to tell you exactly when to come back unless we do the examination. So it's very important that, one, we start that initial screening examination, that your child is seen in the NICU, and also when you get discharged and go home, that you continue to make those follow-up appointments with the retina specialist or pediatric ophthalmologist or whoever is doing those screenings for your baby. Because unlike adults, if you miss 2 weeks, if you miss 3 weeks, and you miss several appointments, it could lead to blindness in a child who's at risk for developing retinal detachment. So critical things are make your examinations, have your baby seen, and if treatment is needed, it's important to catch it early because you can prevent permanent blindness.
Dr. Paul Chan, professor and chair and expert on retinopathy of prematurity, thank you for speaking with us today.
Thank you, Dr. Murray.